WOCA.
Ocala.
That was the first. All right. 5 minutes after 11 o'clock, Dr. Riadh Fakhoury is in the studio. I knew you were out there.
You know, in here, I was in talking to Dan, then I heard that wonderful melody, and I said, you know, that sounds familiar.
You got to be in here. Oh, that's too funny.
That came running.
See, I wouldn't have done that to you if I didn't know you were here. And if it was the beginning of our relationship, I wouldn't have done it
That's
at
right.
all.
No, that was fun.
I would have said I better hold off.
I was enjoying that soothing song, and it
is a pretty piece of music. We don't even know what it's called, do we?
No. But
Who picked it up?
I think you picked it out.
Did I?
You did.
I better find that out in case we ever lose it. I'll need to find it.
It's really nice.
So how are you?
I'm doing great, thanks.
You had a
Larry.
week
How
off
are you?
last week. You did something fun, right?
Yes. My wife and I had a nice time for her birthday and our anniversary, and just had a few days together. So it was nice to get away.
Yeah, she's a pretty lady.
Thank you.
You don't mind
Thank
people
you.
saying that, do you?
She's a beautiful lady.
And beautiful in every way
Yes.
possible, just like you are.
Thank you.
Well, you're not as beautiful on the outside.
No.
I'm teasing.
It's getting worse.
Let me ask you something. We went to visit your office.
Yes.
I wanted to mention that.
It was such an honor having you and Robin come and visit us. Thank you for spending that time with us.
Well, no, thank you for inviting us. My favorite part was the TV show in the waiting room.
You mean WOCA?
You.
That's right.
It was you here.
That's right.
And you could hear me in the background. And there was a patient waiting, and she was really into it. She was really getting into what she was saying, so that was good. In other words, I could witness that it worked.
Yeah, and the calls that we get in are tremendous because they are calls that people have on their mind, and they're looking for those types of answers. And I know the patients are getting those questions and enjoying the answers also.
Which reminds me, I didn't even introduce you, did I? Let me do that. This is the Head to Toe Care Show. Dr. Riadh Fakhoury, of course, is your host, and he is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center. His whole purpose for being here in the radio station so far from his actual office is because he wants to answer your questions. And so you need to call at this number, the WOCA Climate Control Source Hotline, 622-9622, 622-WOCA. If you're out of the area watching online, I know some of you are, the area code is 352-622-9622. And the one question that came to mind when we were walking through your office was about pain. Because I thought, my goodness, this looks like the solution to some problems I've heard. A lot of people have pain, they take a medication, they become lethargic. The medication has this effect.
Yes.
It kills the pain, but it has this other effect.
And sometimes it doesn't even kill the whole pain. It just changes the sensation of the pain. You can still feel it under the subdued feeling of the medication, but you still notice it. So sometimes the medication doesn't actually remove the pain even, but it just changes the sense of how you perceive it. And that's really our goal at the Fakhoury Medical and Chiropractic Center, is to try to help people to recapture their life, be active, be energetic, and not be restricted or pulled down by the pain, and try to help them away from the medications and go to more natural medical and chiropractic and physical medicine approaches to uplift them and get them to a point where they can manage and not always think my neck's hurting and my back's hurting. And the problem, Larry, is so often people don't take care of a problem or injury early on, and it manifests itself 6 months to 2 years later as a chronic problem, and then we're dealing with people that are having long-term pain. We can give them relief, but they'll always need some type of care from that point forward, and that's why if we can get a problem when it's acute or early on, we have so much more success at being able to help them.
And how it really hit us over the head was we saw a man, get off of a motorcycle to come and see you. He was limping, so we just put two and two together, figured he must be coming in for a hurt leg or something like that. And I was thinking to myself, if you were going to see a doctor that was going to prescribe medication, or even give you a medication right there in the office, you could never even drive yourself, let alone on a motorcycle.
Right.
I mean, so it's amazing, really, that we have become a society that depends on chemicals to relieve pain when there is an alternative way.
There is alternatives, and we do at the Fakhoury Medical and Chiropractic Center. We do have Dr. Shanawani, our medical doctor, and there are times for medications, but the type of medications that he prescribes are light anti-inflammatories and light muscle relaxants, not narcotics, but those things that will help us for a short period of time with our physical medicine treatment to get them to get that patient to a point where they're pain-free and don't need the medication. So that's that integrated treatment that we do of multidisciplinary care, but at the same time understanding that we want to do the right thing for the patient and avoid getting them started on the narcotic medication, because it's easy to write that prescription, but after 1 month, that's it. The body is tuned into it and looking for the next prescription. And this is why we see so many referrals from primary care physicians and medical doctors to us, because they're not comfortable writing that prescription. They know we can take care of those problems with people that are having sports injuries or people that are having chronic pain or acute pain like car accidents. And getting those taken care of at the Fakhoury Medical and Chiropractic Center keeps those patients from going back to their primary care doctor with complaints of headaches, neck and back pain, because that primary care doctor is not comfortable with that. They want to take care of your liver and your heart and your blood and those types of things. They don't want to take care of the pain because it's a prescription is their tool to be able to help with that, and they want to try to get away from that, and that's why they're utilizing the Fakhoury Medical and Chiropractic Center more.
Yeah, and I think the understanding that you've expressed to us that you have regarding the relationship between the muscles, the nervous system, and the organs.
Yes.
I mean, clearly it's the full approach that you have at your facility that addresses those different causes of pain. And you do have a phone call. Let's go to the phone. Good morning. Thank you for calling. You're on the air with Dr. Fakhoury.
Yes, good morning, doctor.
Hey, good morning.
Can acupuncture be applied to carpal tunnel to help relieve that situation?
Yes, it can. Yes. The carpal tunnel syndrome, for those that are not familiar with it, is where the nerve called the median nerve, right at your wrist, it crosses on the in between your thumb and the outer part of actually the inner part of your wrist, and there's a strap that goes over that median nerve called the retinaculum, and anytime that nerve gets irritated because of arthritis, because of inflammation, swelling, or maybe the retinaculum, that strap is getting tight, what happens is it'll cause problems radiating into fingers number 1, 2, 3, sometimes weakness in the grip, and we will do different types of treatment for the carpal tunnel syndrome. But acupuncture, you bring it up, and that's a very good point. I love acupuncture, and I love it in the treatment of chronic pain. And it's very helpful for those chronic hip, knees, and wrists. So when something happens like that with a carpal tunnel syndrome, and we've maybe tried the laser, we've tried the manipulation, we've tried ultrasound, and the problem continues, and they're using a cock-up splint and at night to hold the wrist so you don't curl your hand underneath you and bother the median nerve. We'll bring in acupuncture, and it's helpful in many of the cases. So that is a very good point that you bring up.
Do you ever use steroid in application on something like that?
To date, we have not had to, because we've been able to help the majority of the cases staying without having to have the injection in that area. So it's rare that we would have to inject the wrist.
Yeah.
Yes.
Now, carpal tunnel, can that be other than the hand?
There is a tarsal tunnel, which is the same concept of the nerve being pinched in the wrist, but the nerve being pinched in the ankle, causing pain radiating into the foot.
Right.
So there's a tarsal tunnel. There's also a cubital tunnel, where it's another part of in the elbow area where you can get another pinching of the nerve. So there's several areas in the body that you can get a tunnel syndrome. There's also a little one where the median nerve is in the middle of the wrist, on the little part, right below your little finger, right where the wrist attaches to your forearm. There's a little bump there, and that's a little tunnel called the tunnel Guyane, and you can actually get a tunnel syndrome there. A tunnel syndrome is anytime a nerve is getting trapped when it's going through a small enclosure.
Is it possible to have that problem in your foot, which is kind of like your hand?
Yes, you sure can. Yes.
And it's treated the same way.
Yes, and this is where people will come to us and say, my foot is hurting, my toe is hurting, I have weakness in the ankle, and we have to do what we call a differential diagnosis. Is it a pronation problem or flat-footed problem?
Yeah.
Is it a plantar fasciitis? Is it a bone in the ankle that's out of position? Is it the possibility that it's a neuroma that they may be having?
Yeah.
Or is it a tunnel syndrome? And so we are looking at all those different factors to find the best treatment for that individual.
Yeah. Would it be a problem that an athlete would have to be concerned with sooner or later?
If with repetitive stress injury, which a couple shows ago we talked about doing the same thing over and over incorrectly, yes, let's say that you have a bad shoe, a shoe that's non-supportive, and or you're in flip-flops and you're running around doing a lot of heavy lifting and picking without good support in your feet, you could irritate the tendon, you can irritate the nerve, and you can cause problems by doing that repetitive stress injury. So an athlete might be, an athlete doesn't have to be swinging a club or swinging a tennis racket.
Right.
It could be that weekend athlete that's carrying 50 bags of mulch and wearing flip-flops and straining their ankle that way. But yes, people that are putting stress on their joints, whether it's an athletic activity or around the house, they can end up with problems. An example is a young lady that's having a very bad tendonitis, and she's a very athletic young individual, about 16, 17 years old, and she would not listen and stop, and she was getting a tendonitis right in the front of the ankle, almost like a shin splint, and it was actually raising the tendon up because the swelling was getting behind the tendon. And our recommendation was get off of it, get on crutches, get a boot, and she was saying, of course, at 16, 17, she said, I don't want to use crutches in the school, and we tried to encourage her, but she came in a couple days ago. She can't walk now practically, so she's in crutches now. And but it's trying to get these things early on, because if you let it go, it just it'll go from one place to the next and become a bigger problem later on. And getting it early is the best way, because we can address it. So if you're feeling a shoulder pain from playing tennis, if you're feeling a hip pain from golfing, if you get in an accident and your body gets shifted and your back is bothering you, it's a good time to get it checked out, so we don't end up with other problems manifesting themselves over time. And it doesn't have to be a week or 2 or 3 days. It could be 3 months, 6 months, even up to a year afterwards. It could start showing up.
Going back to the hand again, is there like an exercise you can do to help that, like squeezing a rubber ball or something?
Yes, you've seen those stress balls. That's a good thing to do. Also, if you outstretch your arm and you lock your elbow away from your body, and you put your palm like towards the wall that's in front of you, and if you, in other words, if you take your fingertips and pull them up so your palm is facing the wall in front of you with your elbow straight, and then get your fingertips, and those that are on the TV, on the monitors can see me, and you pull your fingertips back towards your nose, you'll feel the stretch in that whole forearm area, which is very helpful.
Okay. Well, thank you very much.
Thank you. Those were wonderful questions. Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Yeah, and ultimately it's addressing pain, isn't it? And the cause of the pain, not just masking the pain. I guess that's the difference between what I came when we went to visit your office. That's what I came out with. Was the painkillers mask the pain, but you really addressed the cause of the pain.
I see you bringing that up, and that's true in that we have to get to the source of it. And sometimes you have to go through the layers to get to the actual problem, because an ankle problem can cause a knee problem, can cause a hip problem, can cause a back problem, and the person may come in with low back pain. Well, we could treat the low back for months, and it won't get better if we don't go to the primary source, which is the ankle that caused the problem, and get to the cause of it and treat it that way.
And how you find that is, I guess that's why you're the doctor, right?
Well, it's the training and it's the experience that helps, and it's also the great teamwork, because at the Fakhoury Medical and Chiropractic Center, it's not one physician. We have medical doctors, we have chiropractors, we have massage therapists, we have rehab specialists, and we bring all these people together. And it might be something that the chiropractor is not really having the answer for, but the medical doctor might, or or we'll pull in one of
right.
our great massage therapists, and they've got years of experience, and they'll say, well, we've done this before, and this is how it's helped this situation. So it's a team approach helping that individual, and all in one location where we can communicate with each other very rapidly and pull the other provider in right on the spot and be able to address it and move forward, because healthcare sometimes moves too slowly. You can get treated, and then that provider says, well, I'm going to refer you out. It might be 3, 4, 5, 6 weeks before you get to that location.
Wow, that's terrible.
And that slows that whole healing process down, because we know time is essential.
Yeah.
And the earlier we take care of it, the better. And then that individual may want to refer you out for a test. It might take 2, 3 weeks. And then they'll say, well, we're going to wait a week till we get the results, another week. So now it's total maybe 2, 3 months before you really address it. We like to move very rapidly and keep the treatment streamlined, the communication streamlined, any special testing, get it done, get the results to you immediately. And if we need to refer you on to somebody else to continue the care, pick up the phone, call them, ask them to get you in quicker. There was an individual that was in a car accident, and from the trauma to her brain, she actually lost vision.
Oh, wow.
And the problem is, this poor lady didn't have any insurance, so
wow.
so nobody would see her, and she needs to see a surgeon, but the surgeon would not see her until she had her vision checked by an ophthalmologist. So part of the added value at the Fakhoury Medical and Chiropractic Center is I called a personal friend who's an ophthalmologist and said, this lady needs to be looked at, can you help her? And he said, of course, if you're calling and you want her to be helped, send her over. So she's going to be looked at, and hopefully help her recover some of that vision that she's lost from the trauma. But it's having the experience also, because we have 25 years of trauma care, accident care. When you can take care of those more complex cases and diagnose those and get to the source of the problem, then the other cases are easier to deal with.
We talk about pain all the time, and I don't want to use like a synonym for pain, but I wanted to ask you about aches, and here's what I mean by that. A pain I associate with, like, here's a specific place on my arm, it's hurting because I cut it, or I broke a bone or something. But an ache is almost like generalized, like I've got this ache in this area.
Yes.
What causes that? What is that?
There's so many things, and you have different nerves in your body that send different types of messages. In your gut, you have different types of receptors, nerve receptors. In your skin, you have a different type of nerve receptors. The ones on the skin are made to be very quick to get the message to your brain. So if a spider is crawling on you, you're going to get that message very rapidly, so you can brush it off, more for protection. In the stomach and the gut, you have deeper, slower type nerve endings, so you'll feel it more like a vague, achy type pain. And there's also something called sclerotogenous pain, which is a different type of nerve pain, which is a vague, achy, where my whole arm aches. Well, the problem's not in the arm, the problem is a pinched nerve in the neck or the mid-back, but it reflects in the arm, and everybody perceives pain or discomfort differently. Some people, I know they're hurting, but their threshold of pain is so high, they don't feel it. So I'll use other words like, if you notice stiffness or achiness or tightness or soreness, and then they'll start understanding, oh yeah, I'm sore. When I move in this direction, I'm sore. So sometimes, as you say, we have to use different synonyms to be able to help the person to communicate with us what they're feeling. It could be burning, it could be tingling, it could be numbness, it could be achiness, it could be crawling sensation. And some people, they may not even feel any of that because their threshold for pain is so high, but what brings them in is they start dropping things. Like with the carpal tunnel syndrome, they may not feel, or a pinched nerve in the neck, they may not feel the pain in the arm, but they'll find that they can start dropping things and they can't grab things or open jars, and then they'll come to the Fakhoury Medical and Chiropractic Center, and it's not the weakness of opening the jar that we're looking at, it's what's causing that weakness, which is the neck or the carpal tunnel or whatever it may be, getting to the source of that.
In your office, when was it Anna? Was that the lady's name?
Yes.
When she gave us a tour, the first door when you go to the left after coming in, it looked almost like a workout room.
Yes.
What is that? A rehab room?
That's our physical rehab room. And there's so much in the way of equipment and things that are available to you, but really, the equipment is wonderful, but it's the staff members, Tyler, Travis, and Brady. They are amazing, and the feedback we get from patients on their work and what they do to help those patients recover from their problems and get back to normal living is incredible. Their hearts are in it, and their hands are in it too. They're manually stretching and getting range of motion, talking to patients about things they could do at home, encouraging that person, because sometimes you're in a rut because you're in pain, but encouraging them through that. It's not a workout, it's not an exercise facility, it's a physical rehab where we re-strengthen and re-stabilize the weak areas of the body to help supplement and add to other treatments in the office, whether it's massage or chiropractic or acupuncture or interventional medicine. It's part of the team approach. And so when Travis Brady and Tyler will work with that individual to bring flexibility and bring range of motion and bring stability to that area, whether it's through equipment. And sometimes we have people that are having imbalance in the office, and it's because they've been in pain for so long, they don't walk properly, and they've lost the sensation of balance in their body.
Right.
So Travis Brady and Tyler will work with them on exercises that will help reestablish that proprioception, or that sense of balance, which is very important in the healing process. So a lot happens in that room. It's about 2,000 square feet, but a lot of healing happens in that room.
When you evaluate a patient or you ask them to assist you in the evaluation, one of the questions I noticed was, what is the pain on a scale of 1 to 10? What does that tell you?
We call that a visual analog scale. 0 to 10. 10 is severe, 0 is nothing. So the person might come in at an 8, and we see how they're doing along the way. Oh, I'm a 5 today, I'm a 3, I'm a 2. So we know we're working in the right direction. If they stay the same, 8, 8, 8, 8, 9, 9, 9, 10, then we know what we're doing is not helping, and we have to reassess within 2-3 visits, why is this patient not responding like the majority of people? Because we get a very high success rate of 90-95% of satisfaction and improvement. But on those few that aren't, do they need to be referred out? Do we need to do an MRI study? Do we need maybe to approach it from a different angle? Or maybe we're not at the cause of the problem, reevaluate the patient and make sure that we're addressing the source of the problem. So we had a young lady, as you can tell, we have all age groups coming into the office. She is 15 years old and low back pain. Well, I would say 97, 98% of the individuals in her age group between 15 to 20 that come in, they respond brilliantly and they do fantastic.
Their bodies are ready to get back in shape, right?
But she wasn't. She's a swimmer, she's very athletic, but she did not respond. We gave her 2-3 visits, 4 visits, just is not responding the way that it was supposed to, so we rapidly sent her to an MRI center, got her in immediately. And similar to this lady that the 17, 18-year-old, the athlete that with the tendonitis in the front of the foot that can't lift her foot up anymore, that's in crutches. She came in yesterday. We had her to a podiatrist, a foot doctor, the same day by calling and asking them to work her in, so that way we can address her situation and co-treat on that. But if somebody's not responding, or like in this case, the patient is not getting better, it's a red flag for us to say, okay, what do we need to do here? And that analog scale helps us, because it's not, oh, I'm better or I'm worse. It's like, I'm an 8 today. And you know that they're hurting.
That's their own assessment of their own selves. In other words, your 10 might be my 7 or vice versa.
That's right. That's exactly right. But, your 7 is your 7, and we can see that. My 10 is my 10, and we can see the changes from there. So everybody's treated as an individual at the Fakhoury Medical and Chiropractic Center, because everybody's problems are sort of unique to themselves. They feel pain differently than the person next to them. They may look like they have a similar problem, but sometimes the actual cause could be completely different, and the type of treatment we do on one person could very well be completely different than the treatment we do on the patient next door.
If you would like to call Dr. Fakhoury, we've got about a minute left. If you have a question for him, this is the WOCA Climate Control Source Hotline, 622-9622. If you don't get through today, or you just prefer to speak in private, you might want to go down to his office, which is right there off of 17th Street, but it's on 16th, right? 16th Lane.
That's right.
Right near that bridge that goes on the 17th Street that goes over the railroad tracks, named after the two governors. And the phone number over there is?
351 888-866-3413. And when you contact the office, one of the ladies will be able to help you, either the front desk or our patient care coordinator, Amy, and answer. So many people have questions. Would my insurance cover it? And what do I need to do? Do I need a referral? You almost never need a referral to be able to come into the Fakhoury Medical and Chiropractic Center. And just if you have a concern or you're having a problem or you've been in a trauma or accident, just call. And the number again is 351-3413. And then we'll be able to see you usually the same day, the next day at the very latest, because again, our goal is to be able to service you as quickly and efficiently as possible, and if we could take care of it, we will. And if we can't, we'll make sure you get to the right place as quickly as possible.
And if you're hurting, you don't need to hurt. Go see Dr. Fakhoury.
That's right. Now, next Wednesday, I want to talk to you and Robin a little bit about the tour and what your thoughts were from your eyes.
Okay.
You know, we're in there every day, 6 days a week, so we get used to seeing things the way we do, but I'd love to hear your input on that.
Oh, and a lot of it has to do with the people we saw.
Oh, good.
The patients, I mean, because they kind of they weren't talking to us, but you could tell they were talking to other people, or you could see what looked like was hurting. Like if they were limping, you could tell it was their foot or whatever, their leg, whatever. So
right.
And it was amazing to me that the guy drove himself in. So I was always under the impression, you're going to see a doctor, you better have somebody drive you, because if he gives you a pill, you're not going to be able to drive home. And he was on a motorcycle. So.
That's right.
And that says everything. I mean, I don't want to take medicine if I don't have to.
That's the way we're a medical and chiropractic center, and we use the least invasive thing to be able to help the person the most effectively.
Yeah. Dr. Fakhoury, thank you so much for what you do with the community, for us all, and for understanding our bodies better.
Thank you very much, Larry. It's a pleasure.
We'll take a little break and be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury, here to help you on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA, The Source.
You're listening to WOCA News Talk 1370, Ocala's source for what's happening in today's hottest, up-to-date news and topics.